I also wanted to share with you some common myths that come up, I suppose generally when people are thinking about self-harm, but also when I've delivered training on this over the years. These are often things that people worry about. So the first myth is that talking about self-harm increases it. I think this is particularly the case when we're dealing with young people, with children. Often adults worry that if I raise this with this young person, it's going to make it worse. There is absolutely no evidence that that is the case. If anything, there is some kind of tentative research that suggests that the opposite is true. So if you talk about self-harm with the young person, if you kind of are open and sort of empathic around it, then it can actually de-escalate distress and kind of reduce the likelihood that the person needs to resort to self-harm as a way to manage their distress. So, you know, please don't worry about kind of raising this as a topic with people, or, you know, if they bring it to you, don't worry about kind of delving into it, because, you know, you're not going to make it any worse. You're not going to increase it. And the same is also true for suicidal kind of thoughts as well. I just want to highlight that. Second myth is that you're responsible for someone's decision to hurt themselves. So sometimes what can happen is we may have had a conversation with a young person, or I don't know, or had some kind of interaction with them at some point, and then we find out later on that they've gone and harmed themselves. And that can leave us feeling really guilty, anxious, maybe worrying that we said something or did something that caused it. So I think this is a really, really important myth to dispel as well, that actually, you know, we aren't responsible for someone's decision to go and harm themselves, even when they're young. And, you know, they largely have that kind of ability to control, and not control, but kind of, I guess, take responsibility for their actions in that sense. And we can't really kind of prevent them or stop them from doing that. If someone wants to engage in that behavior as a way to manage their distress, then they're going to kind of do that. So again, just being mindful of that tendency to take on all the responsibility and try and fix it, when actually that's not yours to take. Another myth that commonly come across is this idea that the degree of self-harm is directly related to the level of distress the person is experiencing. This may be true in some cases, but largely in my experience, the two don't really correlate that well. So, you know, I have worked with young people who are incredibly distressed, but actually are sort of self-harming, perhaps not very frequently, or they may be doing it kind of that lower end of the severity end of the spectrum. But that doesn't mean that they're not very, very distressed. Equally, the opposite can be true. So there can be some people who you might come across who actually their self-harm does seem quite severe, but generally speaking, they're not that distressed. I mean, of course, there's going to be an element of distress, or they probably wouldn't be self-harming, but, you know, compared to some others, they might not be as distressed. So again, just making sure you're not kind of prejudging that when someone comes to you is really important. And then the final myth that I want to dispel is this idea that success is stopping the person from self-harming. Again, I think there's a real kind of pull, a real emotional pull to want to make it better for the young person or the child. And from our perspective, stopping them self-harming would be a great outcome potentially. But actually for the young person or the child, that might not be how they feel about it. You know, as we talked about earlier, it could be that doing that self-harm is stopping them doing something worse. And so actually for them, it's really important to keep it as it is. For others, it might be, actually, I'd like to gradually reduce this over time, but I'm not sure I can fully give it up yet, or I'm not sure I can stop. And that's okay too. So it's really important that we don't kind of see this as, oh, if I don't get the person to stop self-harming, I failed, or they failed. And because often that's not what it's about. It can be a lot more complex than that when we break it down.